We are here to talk to you today about thyroid testing, blood thyroid testing. Thyroid symptoms are so ubiquitous, so many people experience them. Things like weight gain or inability to lose weight, cold hands and feet, thinning hair, dry skin, constipation, depression, anxiety even, insomnia, right? Go on and on. These are very common. However, when most people go in to talk to their doctor about these complaints and they test their thyroid, typically it's one, maybe three markers that are tested. We're looking at TSH, or thyroid stimulating hormone. That's the default marker to test, and I'll elaborate on what that is in a few minutes. Maybe free T3 and maybe free T4 if you're lucky.
Yeah,
exactly.
if you're lucky.
Mm-hmm.
Yeah.
So to give you an idea, this would be the equivalent of taking your car into the mechanic because it's making a weird sound, it's not performing the same way. They check your oil and say that your car is fine.
That's it.
So that's it. So what we're going to do today is dive into the 11 different markers that you can run, that are imperative to run in order to get a full thyroid assessment. It's the patterns that can be found within these markers that can tell us really important information, such as, is there primary hypothyroidism? So is there true hypothyroidism reflected in a problem with the thyroid itself? I'm pointing because that's where your thyroid is. Could it be that your thyroid is fine, but it's actually cellular hypothyroidism? So you have all the symptoms of hypothyroidism, but it's not stemming from the thyroid itself. It's stemming from how your body is using thyroid hormone. Or could it be something completely separate, like stress, for example, that's affecting the utilization of thyroid hormone? So there's many different patterns that we'll see, and that's the beauty and really the importance of having a full assessment of the thyroid. And that's what we're going to dive into today.
And I think what we see a lot of times is that we have clients come in and they just had the TSH done. And they're told, you're within range, everything looks fine, but you don't feel fine.
Exactly.
Right? Like you're seeking another answer because you know intuitively that you don't feel fine. And we see this with women. It's becoming more and more common with women in general, where we see a hypothyroid or a thyroid problem. So we're going to share the screen with you and walk you through one of the labs that we could run and give you the data of why we need to look deeper at the thyroid, and we need to look at a much more narrow range profile, right? When we're talking about thyroid.
Exactly.
All right.